Right. Good morning. I'm Dr. John Shell. I'm one of the psychologists over in the Health Center. So I'm here to talk to you a little bit about psychological services on campus and some of the mental health resources that, again, may support you in your academic mission here, just to kind of address any type of quality of life issues you may have or, as I said, any type of mental health concerns. So we're part of the Health Center. You'll hear a little bit more about the Health Center in just a moment. But our role on campus is really to provide psychological services in the fullest spectrum of those services to students. Primarily, we do everything from crisis intervention work if somebody has sort of an unanticipated problem. There's a crisis of some sort. Sometimes things will pop up that you really don't anticipate. You have a conflict within your department or a conflict with another student. This is causing you some distress, or you're struggling with adjustment. Maybe you've done fine academically, but all of a sudden, stepping into graduate school or the program that you're in, things don't go as smoothly as you think. We're here to provide support in all of those ways. But we also provide support in the sense of sort of ongoing issues that sometimes students come to school with. So you may already have a history of depression or anxiety, other types of mental health concerns, and maybe you've gotten treatment before, but all of a sudden you're away from your primary providers and you need to reestablish some new clinical connections just to kind of keep that treatment going. So we can provide everything from weekly therapy, if that's what you need, to we do some support groups. We do a lot of assessment work. So sometimes students come in and they're having academic problems, as I said, for the first time. So we could do ADHD testing, other types of learning types of testing to help make sure that, that things are going as they're supposed to, or help you figure out what's not working. We also do offer some substance abuse counseling. We've got a substance abuse counselor that works with us in our office, and I oversee part of that program with her. So again, if you're in recovery or working toward becoming maybe more solid in your recovery, we can help with those types of services. Or if, as I said before, you get here and all of a sudden you start to have more issues, more concerns than you anticipate, we're there to sort of assess those and help you sort that out as well. In terms of other things, as I said, in a more, worrisome way, sometimes students will encounter, maybe as an instructor in your class, you'll have a student that you're teaching, or maybe somebody in your lab that you're working with, where you don't have any mental health concerns, but you have concerns about those individuals. We're also there to serve as consultants to you in that way as well. So if you've got a student who maybe isn't showing up for class, you start talking to them a little bit about what's going on, and they reveal, something's happened. Maybe they've experienced some sort of trauma. Maybe they've had an exacerbation of their mental health concerns. Know that we're available, as a resource for them, so you can direct them to us. But also know that if you feel sort of stuck and you don't know what to do or how to approach that student, you can also call our office, speak to our on-call clinician, and get some support so that you can, again, work with that student in the best way possible. We also, as I said, do a lot of different types of testing, so we've got all those services. And we also do a lot of sort of outreach and programming on campus as well. One of our big initiatives this fall is something called National Depression Screening Day. We've been doing this for a lot of years, so you'll hear more about that as we get into October. We also have Step Up and Speak Out, which is one of our largest initiatives on campus, which is a very comprehensive sort of compendium of information for faculty, staff. As graduate students, if you're teaching or if you have a graduate student appointment, you should also have received one of these packets of information. And it's a wealth of information that just guides you through the process and what the resources here on campus are. So there's a lot of different things that our office sort of can be available to you to help with. As I said, we're part of the Health Center, so we also work with the physicians and the nurses on campus. If you, again, have any type of mental health need where you're taking medication, we can coordinate that within the Health Center as well, and we have an on-call, we have a psychiatrist we work with on a consulting basis as well. So again, the whole range of psychological services is available if you need it, either for yourself or for somebody else you're concerned about. Just know that we're there and we're available for your needs. So wish you well here at Kent State, wish you well in your graduate endeavors, and let us know if there's something that you need our help with. But thank you.